Well, thanks for everybody coming. We, as everybody may not know, the governor's confirmed we're going into session at noon on Friday. And there's a number of things of unfinished business that are going to be accomplished. Amongst them, whatever we know was Senate File 3322. And the purpose of today's discussion is to look at some things that might be carried forward. And I'll just bring everybody up to speed with where we are with discussions. I think we're pretty close to a consensus agreement with all the parties. The plan is to reintroduce Senate File 3322 as Senate File Special Session, Senate File 4 or whatever. There's going to be, it's actually going to become two different bills. We're going to delete Article 9 from the draft that we're going to be introducing. We just had it drafted the way it was, and to get it moving along. By the way, there's two technical changes. The bill is identical except for two fixes. One is the APA, Advanced Practice Nurses language changed a little bit into current law, so they just conformed it to that, and there was some other minor technical change. But except for that, for people watching and hoping it passes, Articles 1 through 8 will be virtually identical to what they were. And Article 9, which is the emergency authority given to the commissioner, and the waivers, 50 days and all that, is going to be carried in a separate bill, probably not taken up until Monday, I don't think. And so that's going to be the heart of what we're going to talk about today. In talking to various leaders, there seems to be no objection at all to carrying everything forward 60 days, which is, I know, really important to the counties and the department, and to me and all kinds of constituents and clients out there. And then the question was, what shall we continue forward with beyond that? And we started with a list that was a little longer. The counties, I think, had 11 things. They might talk about that. And the providers had some. And we settled down to a list of, I don't know what the latest count is, 11 or 10 or something. And we'll talk about all those coming up right now. So on Monday, so we're going to get a bill put together that's going to be the waiver extensions, both the 60-day and the up until June 30th of 2021. However, in that bill, there is not going to be the official empowerment by the legislature to the department or the governor to actually do what was done by Executive Order 20-12. And so it's a bit of a compromise, and this is a good time for honorable compromise. I think we've achieved it. I would have liked to carry forward that language, but I did not prevail. We had a really good discussion, and to the heart of what's going on for the clients that we're going to be touching, extending these waivers is really important. And so as you read it, you'll see like little mention of the word authority. We're going to discuss the waivers that are being carried forward in some kind of neutral reference to that. So that is not drafted yet. That's still being worked out. As soon as that is put together, we'll be jacketing that and getting it posted for people to look at. But the part that is going to be most interesting to folks are what waivers are going to be carried forward. So with that, we have a number of testifiers, including Commissioner Harpstead, who I still can't see. When I get you going, I'm going to try to get my video to work again here. Commissioner, welcome to the committee. And I think that people have seen the draft. There's a number of letters from various groups that you can look over. We have a number of testifiers, and we'll go till we're done. I'll be leaving somewhere in the range of 3:45 for another commitment, and Senator Utke will carry forward beyond there. So we have ample time to do what we have to do. But I'm really pleased we have gotten this far together on this really important work. So with that, Commissioner, welcome to the first meeting of the Interim Human Services Committee. Thank you.
Thank you, Chair Abler and committee members. I'm recalling today back to March 16th, 3 lifetimes ago, when this committee passed Senate File 4200, authorizing me to flex rules and regulations that would help counties, tribes, health plans, providers, and most importantly, Minnesotans, get through COVID without losing benefits and without being overly burdened with paperwork while understaffed and working remotely. Fast forward to today, when we've made those flexibilities available to the people of Minnesota instead through Executive Orders 2011 and 2012 and miscellaneous standing authorities. We've received thanks and sighs of relief from lots of Minnesotans on the COVID front lines for the flexibility and freedom to deal with this once-in-a-century pandemic while continuing to serve. We've also been able to discuss each flexibility before, during, and after using them with the 4 chairs of the House and Senate Health and Human Services Committees. And I'm pleased to say that partially due to those regular communications, they have not once exercised their right to stop any of the flexibilities we've put in place. Along the way, we've often said to each other within DHS or with our chairs or with our community partners, why don't we always do it this way about one or another temporary approach? And of course, the whole world has learned to work with tele-everything in ways we never would have pushed ourselves to do without COVID. As we go into this special session of the legislature, we hold as absolutely critical to provide for a 60-day ramp-up return to some kind of new normal. Needless to say, it would be impossible to stand all these rules and regulations back up the day after the declaration of the end of the state peacetime emergency. So we, our county and tribal partners and community partners, must have your support for a gradual return. Actually, our partners need this far more than DHS does. If you think about it, if the end of the emergency were declared in June, in some areas, they would have to do 2 quarters worth of work in 1 quarter to catch up on assessments, background checks, recertifications, etc. With a 60-day ramp up, they'd have to do that in 2 months. Without one, they'd have to do that overnight. Many of us have pondered whether any of our flexibilities should remain in place after the emergency, tele-everything being the most popular. So I'm grateful to the Association of Minnesota Counties who took the lead on convening a series of meetings to list their recommendations. We ran their list by tribal leaders last week, quickly examined them for appropriateness and feasibility, and have a list to present to you today for your consideration to keep the train on the tracks as we all move out of COVID and back to a new normal. It will also give us time to see what's working well and what we may want to work with you all to continue long after COVID. This legislation would also allow us to continue those waivers that are required by federal law or that allow Minnesota to receive additional federal funding as we respond to COVID. Thank you once again for this committee's foresight in working to enact our flexibility legislation back in March, and for taking the lead on working to enact the continuation and end of it now, and going forward in a way that just makes for sensible government. Thank you.
Well, thank you, Commissioner. And actually, I started out I'm pretty proud. I figured it out all by myself and didn't even lose connections. Thank you. And I want to thank you for your really good communications with however many chairs you had to communicate with, at least 4 or 5, I'm sure. And I think it's, when people look back at, I think at this whole time about things that worked really well and things that didn't work really well, I think you've worked day in and day out. I hope you had a day off in the last month, but it's, and I wouldn't be surprised if you haven't, but I think the interactions in our arena have been particularly good on the human services side. And so for your staff and Mr. Burdick and you and others who have been Dreamin and the whole crew that have really risen to the occasion, I want to commend you for that.
Thank you.
So is Mr. Burdick going to go through the list? Is that the plan? Okay. Where are you, Matt? Welcome to the committee.
Thank you, Mr. Chair. For the record, Matt Burdick, Director of State Government Relations with the Department of Human Services. I will walk through the 13 items that are included in the bill for continuation. I've also got other folks from our DHS legislative team here who can help answer more detailed questions, but I'll give a little high-level summary. I believe everyone should have a document that kind of walks through these, and they're in a little bit different order than it's in the bill language because we kind of bucketed them by themes.
Hang on, Mr. Burdick. Senator Isaacson, did you want to say something now? You're certainly welcome to.
Yeah, I just want to make sure I heard that correctly. Did I hear the commissioner say now that we are in a past tense sense moving on from COVID?
There you go. I think you heard it here in the committee. I think Commissioner Harpstead announced that COVID is, never mind, that's, maybe you don't want to answer yourself, Commissioner.
There,
You're still muted.
still muted. How's
There you go.
that?
That's-
Yeah,
There's
I'm
gonna be a
not
whole bunch of
qualified.
Zoom jokes coming up that will,
Yeah.
hey, unmute yourself. Anyway, go ahead.
So Chairman Abler and members of the committee, I am not qualified to declare an end to a pandemic. I'm just
Right.
suggesting that as we come out of it, whenever
Yeah.
that is.
Okay.
here's the deal.
Okay.
Yeah.
I thought I heard that, but then I'm like, I just want to make sure. What I didn't want to happen is if someone leaves this meeting saying, "Well, Commissioner Mount, Harpstead says we don't have to worry about this." I just want to make sure we're on the record that that's not what we're saying. That we're just
That is not what we're saying.
got it. All right. Thank you very much. Appreciate it.
Thanks for asking.
Okay, and so, and just I want to remark that the list that you see in front of you is as long as the list is going to get. If there's somebody on the committee or members of the public that have some stringent, just whatever, strident or really bad objections to something, there's no effort to slide something through. The list is getting close, but I think it still might change a bit. So just keep that in mind as we go forward. So, Mr. Burdick, back to your discussion.
Thank you, Mr. Chair. So I'm walking through the document that begins with the header telemedicine and remote delivery of services. And as you'll see, that is really the bulk of the changes that are included here that would continue through June 30th of 2021. The first item, CB15, allows for phone or video visits for assessments related to waivered programs. The second item, CB16, this is probably the most expansive of the set of waivers here. And this was really about waiving a number of things that are in state law or federal law around the way that we provide telemedicine services for people on medical assistance and Minnesota Care. And so this includes things like allowing the use of telephone or other non-traditional mode of telemedicine. We have a limit in state law of only having 3 telemedicine visits per week that we would be waiving. And then allowing that the first time someone sees a provider, that could also be via telemedicine. And throughout all of these, what we've heard from a lot of folks is that even as the pandemic reaches a point where it's we have more people out and about in the community, there still needs to be the ability to provide healthcare in this more flexible fashion to allow safe and ensure access to coverage. The next item is CB21. This simply extends those same flexibilities around telemedicine to some of our grant programs. And these grant programs are specific to providing mental health services in schools. CB24 is allowing phone or video to be used for targeted case management visits so that case managers can be working with their clients remotely. CB30, this actually expands who can deliver care via telemedicine, especially in our behavioral health space. We have a number of practitioners that practice under the license of a licensed professional, and this allows those individuals to also deliver care via telemedicine. CV44, this allows for the remote delivery of adult day services. And then CB43 allows for the remote delivery of home and community-based waivered services for people with disabilities. Then moving on to CV50, this allows for, again, waiver of face-to-face requirements in our early intensive developmental and behavioral intervention service, which serves children with autism. And then finally, there's a partial continuation of some flexibilities provided around the personal care assistance program. This would waive the requirement that there be in-person supervision of qualified professionals and allows for that to occur in a different fashion. And then there was, moving on to the last page here, there's 4 items here that are not in the bucket of tele-everything, as the commissioner talked about. The first 2 relate to our housing support program, which is an income benefit that helps people who have disabilities or disabling conditions to afford their housing. And what this allows is some flexibility should we have the need to isolate someone because they are COVID positive or have been exposed, and making sure that people don't lose their permanent home when they are temporarily away from home due to risks related to COVID. The next item here allows for some processes right now when someone is in a state-operated behavioral health facility and no longer needs that level of care. At a certain point, the counties become responsible for the cost of that care. However, due to COVID, finding community placements can sometimes be a challenge. And so this allows for a process to determine that, but for COVID, someone would have been placed. And so not having the counties be financially responsible in those circumstances. And then the last item here allows for people to have longer periods of prescription drug coverage. Right now, we typically allow for 34 days before someone has to go back to the pharmacy to get a refill. And this would continue for certain drugs that are maintenance drugs to continue for up to 90 days for people on medical assistance and Minnesota Care. That is the list that is included in this bill. And I'm happy to stand for questions or refer to my colleagues who can speak to any of these in greater depth.
Well, thanks. I just have a comment, and then if members have questions, at least in our Zoom land here, if the way we do in our committee, you raise your hand or you say, Mr. Chair, or hello, or something. So if you feel inclined to want to say something, don't be afraid just to speak up, because I don't have all the people on my screen here. There was a desire for some additional inclusions on this list, and some of them were concerns about childcare, quality of care for child protection matters, and that was kind of problematic. Those can be discussed again next year, and we'll see how they go. They'll be extended 60 days, but not longer. And then there's the question about the fingerprinting is a real problem. And I tried to do some work internally about that because it was a backlog and you couldn't even get them for a while. And so that was too high of a hill to climb, given all the challenges in that topic and the people who have dealt with fingerprints and background studies and letting some things go for a while. It's not an easy discussion. I think it's worthy for next year's work. And so the things we're not including doesn't mean that they're never a good idea for continuation. It means that it's not a readily agreeable consensus position to get to, or there's money or other complicating factors. These, should this bill become law, these would extend until the end of the fiscal year, June 30th of next year. And if they want to go past that, we'd still have to act independently on that. So any questions from any members, or then we're going to turn to testimony in a minute, but any other comments or from anybody? Commissioner, you're satisfied we're ready to move your testimony? Okay. Well, let's do that then. And we have a pharmacist, Dr. Jessica Astrup Ehret is here, and I'm very happy you can join us today. Welcome to the committee, and tell us who you are and then tell us what's on your mind.
Thank you for having me. Good afternoon, members and members of the committee and chair. I'm sorry I had a little time to prepare for this, so I feel a little, this is my first Zoom testimony. So my name is Jessica Astrup Ehret. I'm a pharmacist and third generation owner at Astrup Companies. I think I've testified maybe in front of some of you before. We have 15 community pharmacies or retail pharmacies throughout the state of Minnesota, 4 long-term care pharmacies, and a specialty infusion pharmacy here in the metro. We serve significant proportion of Medicaid patients, as most independent pharmacies do. And I have some kudos and a few concerns to lay out there today. As far as in our organization, I serve as a board member, and I also do work as a staff pharmacist, primarily in Northfield and Faribault. And today I'm also testifying as a member of MPHA, the Minnesota Pharmacists Association. So the current pandemic has created many challenges for us, but it's also actually created many opportunities for pharmacists. And I think it's important that we acknowledge that pharmacists are often left out of the healthcare conversation, and being included in things like the remote delivery and telemedicine for our MTM services has been a game changer for our patients and for our business. So I'm really happy to hear that that is moving forward and being extended. And I hope that that's an ongoing thing our patients have been very receptive to that, and we've been able to complete a lot more visits than we had been before. There had been some limitations there for us. I also think that the 60-day ramp off, or 60 days to get back to our new or our previous normal, or whatever our new normal is really smart. I think it's very hard for anyone to take one day we're here and the next day we're somewhere different. So we are very supportive of that ramp off to move back towards normal whenever that may be, hopefully sooner rather than later, but not rushing things. However, we are here today to oppose the extension of the 90-day fills of maintenance medications. And I hope people have questions about this. I know that many people think that 90-day fills offer significant efficiencies in the pharmacy, and that's absolutely true. If we can synchronize and fill 90 days for a patient, we don't have to see them for 3 months. And that, sounds great from an efficiency standpoint. Unfortunately, many of our patients need more than efficiency in their care. Our patients need higher touch. They need to hear from us and see us and be monitored by us monthly. I have kind of a fourfold fear that goes along with this 90-day extension. Extending it to me into 2021, well into 2021, starts to feel like permanent change. It feels like it would be difficult for our patients and for our pharmacies and for the state to go back to allowing only 34 days. And it's that long-term nature of this decision that is scary. It was absolutely beneficial during the pandemic to ensure that my patients had what they need and weren't victim to current drug shortages for as much of it as possible. However, on the long term, that's where my fear comes into play. So I said my fear is fourfold. The 4 factors that I was thinking about in my short preparation for this, the quick things that came to mind were patient safety, medication waste, the viability of my business, operating small retail pharmacies, often the only pharmacy in town or even in the county, and then the potential for encroachment of pharmacy benefit managers into our business, which continues to be a detriment. So to elaborate, patient safety, I'm trying not to generalize on the Medicaid population, so I apologize if it comes across that way. However, I find that my patients who qualify for Medicaid programs are often plagued by many additional challenges that some of those in the commercial markets, even the Medicare markets, aren't plagued with. Other social determinants become a factor, and unfortunately, the challenges and health disparities that they face tend to require more time and effort of the pharmacist. And this is where my independent pharmacy team really shines in taking care of these patients. It's very important to us that we see these patients regularly, because it's different if someone goes off an antidepressant for 14 days. If someone goes off an antidepressant for 84 days, we have a problem. And so I need to see my patients to know that everything's okay and that they're taking their medications appropriately. If I don't have that touch point with patients because they're able to get 90 days, I'm fearful what that means for my patients. So going forward beyond the peacetime emergency, beyond the pandemic, and continuing to fill medications for 90 days, feels like we could lose patients and have more gaps in care that pharmacists are currently filling. And I don't know if that's always acknowledged, where pharmacists are that really important touch point for patients. Second, from a medication waste standpoint, this is the one that's kind of ironic to me with this decision. It feels like a fast decision because the Medicaid programs in Minnesota have always really focused on eliminating or minimizing waste. I know in pharmacy land, we always think that medication synchronization is a really good practice. If someone's on 10 medications, let's line them up, let's fill them once every 30 or 90 days, save the patients a trip. But we understand the reasons for not doing those autofill, having those triggers for the Medicaid population to prevent waste. However, moving towards a 90-day fill encourages significant waste. If a patient's 2 weeks into a 90-day fill, they need a dose increase. Our dose increases aren't always, you can take 2 of what you currently have. The rest of that fill is disposable. Patients not only have to figure out how to dispose of that safely, but it's also just waste to the system. So I do worry about medication waste and do find it a little bit ironic that MedSync isn't allowed, but then we move towards 90-day fills. Third, viability of my business. And I do put this third for a reason. This isn't of primary concern, but we do continue to have things that we feel like we're stepping up, we're filling gaps in the care system during this pandemic. We're seeing our patients and we're encouraging them to seek care for acute conditions. We're encouraging them to go see their doctor despite their fears of the pandemic and fears of being in a clinic. And then it's like one thing after another, our feet get cut out from under us. And this moving to more 90-day supplies is less money in the door for pharmacies. Any savings that are found from this is on the dispensing fee that we no longer receive. And one would make the argument, well, you're only filling it once, costs you $10.55 to move a prescription out the door. You shouldn't need those other dispensing fees. However, our fixed costs don't change. Whether we're taking care of someone every 30 days, we still have to have a building and a pharmacist in that pharmacy all the time. We're there to take care of patients. And we do rely on those 30-day fills to keep our lights on, especially in our small rural communities. And then lastly, and least importantly, but potentially the scariest one of all, pharmacy benefit manager encroachment. We've had a lot of talk over the last couple of years about pharmacy benefit managers, and pharmacy benefit managers love 90-day supplies. They love pushing prescriptions to their own mail order pharmacies, and mail order pharmacies want to operate on auto-generated 90-day prescriptions. And the state Medicaid population would not benefit from that. A population who's used to receiving prescriptions every 30 days and having a touch point with a pharmacist in person now has to remember to order their medications 14 to 21 days in advance. That's where a community pharmacy is going to have to fill in the gaps, because our patients, actually humans in general, are not wired to think, oh, I have half a bottle left, I should call in my refill. So we're concerned about the efficiencies that would be gained on the side of mail order pharmacy. And because of the involvement of pharmacy benefit managers in our state Medicaid programs, we see that there's a lot of potential to pull volume out of our local pharmacies and into these more efficient factory-like pharmacies where patient care tends to be lost. I didn't at all read my notes, so I probably missed a few things that I wanted to say. But I really appreciate the opportunity to testify today, and I'm open to any questions. I do have to jump off shortly after this, but Andrea is going to step back on, and she can get back with questions if people think of them later.
Well, thank you, Dr. Astrup-Ehret. I'm really glad you're here, and you did marvelously. I think you can be proud of your performance here in this Zoom. A lot of firsts for us on this Zoom thing. First time I got lost in the ether of my Zoom. That's kind of exciting. Anyway, so, and just to offer my thoughts, and then Senator Kiffmeyer and whoever else wants to chat about this, on the list, this is the one I have the greatest concern about. And you've been actually quite eloquent in expressing my concerns about that. And we're going to be faced with many really hard choices coming up about how we're going to manage our money. This is going to be the first of many of those discussions, but I'm concerned about the ill effects on the patients and also on the small communities. And I'll just emphasize even louder than you did, just because the PBMs are they're well intended, but sometimes they're just businesses, and so I'm concerned about losing the touch of the local pharmacist. And I've said at least 5 times about It's a Wonderful Life. And the personal touch that gets lost, even though the PBMs have someone you can call, it's not the same. So anyway, with that, Senator Kiffmeyer.
Thank you, Mr. Chair. So the question I have for you, and the Zoom thing cuts off the last part of your name, so I didn't get your last name. Ehret, is that it?
That is, yes.
Okay, all right. So my question is, you mentioned patients going off medications after 14 days. But because they have a 34-day prescription, they will come back earlier for a refill. Whereas if it's a 90-day, you might have a 84-day window of time. If they don't come back, if they don't take the prescription after 14 days, why would they even come in for a refill if they haven't taken it for 2 weeks?
Yeah, that's a very fair question.
Dr. Astrup-Ehret.
Sorry, I forget my
All right, perfect.
That's a really good question. So it depends on the pharmacy that they use and the level of care that's being provided. You're much more inclined to get a pharmacist to follow up on a medication that requires, I keep using the thought of mental health type medications or antidepressants because they're very important that people maintain them for a long course before they have an effect of their treatment. But a pharmacist like ours, an independent pharmacy, or many of our good retail pharmacies in the state have protocols to follow up after 7 and 14 days to make sure that patients are taking their medication. We also have triggers to let us know when patients are late on a refill. So even at the very minimum, if someone is late on a refill and they've been off of a medication for 2 weeks versus being off of a medication for 3 months, the potential health detriments are much less than they would be down the line 3 months or a quarter of the year.
Sure. I understand that, Ms.
Very
Eric,
good point.
but now, thank you. Oh, thank you, Mr. Chair. We've gotten used to Zoom and forget.
That's okay.
Thank you, Ms. Eric and Mr. Chairman. So, Ms. Eric, I understand now. It's because your retail pharmacy initiates contact that would be required on a 34-day refill, but on a 90-day refill, that initiation would come much later. So I get that understanding, and thank you for being that kind of retail pharmacy that does look out for folks, and it's not just a script that you write and then you walk away, but caring for the people that you serve. That's good to hear, but now I understand the connection. Thank you. Thank you,
Yeah,
Mr.
thank you.
Chairman.
Yeah, thanks. Senator Benson.
Thank you, Mr. Chair and Commissioner Dr. Ehrt. I'm really torn on this because I'm glad we're looking for savings. I think there is convenience in someone being able to choose a 90-day refill if they're going to take an extended vacation. One of the challenges we face, particularly in rural Minnesota, but as we're finding out in some of our core cities, there are essential independent pharmacists that do, for example, compounding that Walgreens perhaps doesn't do. They're specialty pharmacies that make things available. And so PBMs can handle a lot of easy mail order work. We get really complicated healthcare access issues when we start to lose independent, non-chain operated or non-PBM affiliated pharmacies. So on this one, I have to say I am grateful that we are looking for ways to save money. But I think if we're going to do something like this, it has to be balanced, that the remainder of the relationship, for example, the PBM relationship, that independent pharmacies would have to be reimbursed fairly in comparison to any affiliated pharmacy that a PBM might have. We've had a lot of vertical integration in the provision of pharmacy management. And so a PBM will have a mail order pharmacy or will have a tight relationship with the chain and steer people there so that they keep their profits internal to their system. Yet Minnesotans need access to independent pharmacies. So if we're going to move forward with something like this, we need to have some rebalancing of how PBMs deal fairly with pharmacies that give access to Minnesotans where they most need it, where somebody else might not want to do that work.
Thanks. So Senator Benson, is that a statement, or do you want Dr. Esther Barrett to reply?
That's a statement, and I will follow up with her. If I find some PBM language that I think would be amenable to this committee, I'll bring it forward. But without doing some PBM reforms, I'm a little nervous. It feels like this is short term, but in reality, it's almost a year from now that this policy would be in place. So that's a year of revenue impact for some of our pharmacies.
Yeah, thank you. And just to remember, in the base amount of the bill is going to be a 60-day extension. And then this is a discussion of longer extensions. Any other members with comments or questions on this part? Sing out. Commissioner Harpsted, did you want to offer any more comments on this section that we're going to move on to the next? No? Okay. Mr. Burdick, I have a question for you or somebody. I'm going to be leaving sooner than I would have liked, but just have a question on CB 38, the flexibility in the housing requirements. There was some fiscal part to that. Did you sort out, is that cash or is it just some kind of is there an amount of money? It was kind of offset by the money savings on this pharmacy piece here. Is there actually a fiscal note that it costs $200,000, or is it just a fiscal sort of matter that you can't quantify?
Mr. Chair, I know my colleague Dave Greenman is on the line, so I'd probably
Oh.
defer to him on all things budgets. They don't let me near the numbers, so.
Okay, well, you could get injured. These numbers can be very dangerous. So the number tamer is here, so I feel secure.
Mr. Chair, Dave Greenman, Budget Director with the Department of Human Services. Are you referring to the housing support waiver that allows people to be temporarily absent?
Yes.
Okay, that that does have a cost. It's about $207,000 based on an assumption that it ends June 30th, and so there would be additional costs if it were extended beyond June 30th. The savings, the cost is for people who are absent due to having a COVID-related illness, and it allows them to be gone an extended period of time and come back, and it saves their spot, basically. The cost or that cost is significantly less than the savings that are derived from the pharmacy, the 90-day renewal on the pharmacy. So there's, if you put them together, the savings from the pharmacy proposal more than offsets the cost of the housing support provision.
And just to beg the obvious question, then what are the savings from the pharmacy 90-day proposal? Couple million?
Our assumption right now is it's about $1.8 million.
Okay.
For 3 months, and it's about another $600,000 if you extend it for an additional month.
Okay, very good. So anybody have questions about, let's move on then. Ms. Grafstrom, welcome to the committee. Welcome, nice to see you again. All those little squares here, we're doing Hollywood squares again here. So you're not the secret square since you didn't chime on. Go ahead.
Thank you. Good afternoon, Mr. Chair and committee members. For the record, my name is Sarah Grafstrom. I am the Director of State and Federal Policy at ARM. Thank you for the opportunity to provide a few brief comments this afternoon on the importance of extending some of the peacetime emergency waivers that have been put in place by the Department of Human Services. The first waiver I would like to speak to is the ability for home and community-based service providers to deliver some services remotely. This option has been critical in making sure that services have not been interrupted during the COVID pandemic. Additionally, remote supports have empowered people and their teams to be creative in service delivery options and tailor them to a person's preferences, needs, and individual circumstances. Providers have been able to support people in maintaining valuable social connections with friends, coworkers, family, and staff through a variety of remote platforms while maintaining the safety of the individuals they support and their staff. Additionally, many of our members have shared with me stories of providing support to individuals who would oftentimes refuse services going into their homes. Now, with the ability to provide that service remotely, individuals are more likely to get on the phone or get on a video chat, and the provider is more likely to keep contact with the individual rather than the alternative of driving to the person's home and not having the door opened and the service refused. Remote supports is another option for individuals to receive the person-centered services they need to maintain their independence, and we are grateful to see it included in the list of waivers to extend. Finally, I just would like to speak briefly to the waiver of certain background study requirements. ARM would like to express our support of a phase-in for the fingerprinting requirement, but emphasize the chair's previous comments around some of the issues with the fingerprinting process. Prior to the COVID pandemic, the fingerprinting component of the background study process was a challenge at times, with fingerprinting sites and hours of operation in some parts of the state scarce and miles away. These issues have really been amplified with the pandemic. As we work to get new staff that were brought on during the pandemic in compliance, a phase-in or extended period of time is critical to ensure that there is not a backlog in fingerprinting and background studies that would further exacerbate our workforce crisis and staffing shortage. Thank you, Mr. Chair, and with that, I'm happy to answer any questions.
Well, thank you, and I just want to reiterate my appreciation for the last concern you expressed. The only requirement to get a new thing added to the list is the agreement of all 4 caucuses and every significant chair involved. So not just words. So it was a little torturous getting the approvals of these. And I think the whole committee understands the challenges you're facing. And I'm sorry we can't solve it all. At least you get 60 days. And
Yep.
that's the best I can offer. Anybody else want to chat about that topic while we're on it? Not seeing anybody. So, but I'm really happy. And I just again want to commend the department. I wish some of these things would have gone faster, but there was no end of pressure and challenges, and to stand up as many waivers as were put together without even thinking that we had to do it. I just want to just commend them for the efforts they are doing. I think if this pandemic goes on another year or so, we'll really get these all figured out. Not that I'm going to announce it's going to go on for a year, Senator Isaacson. Okay, thank you very much. And Commissioner Morris, welcome. Are you there? Welcome to the committee. There you are. Hi,
Here I am.
welcome back.
Hello, thank you, Chair Abler and members of the committee. My name is Susan Morris. I'm an Iceni County Commissioner, and I'm the past president of the Association of Minnesota Counties. COVID-19 has taught us many things, and that one thing that we've learned is that we can do business differently than we've done in the past. Oh, and I do have a rooster in the background, so if you hear him, you're not imagining things.
I'm not sure how many roosters have been on Zoom meetings. I think we should start.
Okay, well,
go ahead, welcome.
It is,
so mine's
it
now
is
the
quite a
first.
treat to have Commissioner Morris on a call and then her rooster crows and you realize that that was actually a rooster. It takes
Yeah, that's pretty good.
So Senator Benson and I were on a call previously today, and I think, were my roosters crowing then? They probably
your roosters were crowing.
Yeah.
Yes.
I'm so used to it. So anyways, I shouldn't take any more time, but anyway. We all want to provide services in an efficient, effective manner with good customer service. Counties are the incubator of innovation. County governments have had to adopt a new order in order to protect our communities and serve Minnesotans. That's why the Association of Minnesota Counties has put together the Blue Ribbon Committee. And we're examining all county operations during this time. And we're identifying best practices, developing innovations, and leveraging technology to better provide services. Through COVID and always, our goal is to protect the safety of our clients and our staff while promoting the efficiency and equity of our programs. Waivers issued by the Department of Human Services have made it possible for counties to continue to deliver human services during this pandemic. We appreciate the work DHS has done on all the waivers. When it comes to human services, AMC works closely with all of our human service directors from across the state and identify a list of priority waivers to be extended as we continue to the COVID-19. What we have identified are waivers that improve efficiency, protect program integrity, improve access, and protect the health of our staff and clients. What we were asking for is an extension of this list of waivers until next year so that counties can continue to provide services safely. We look forward to coming back next year and working together to review this work and continue to identify some potential and longer-term innovations.
Thank
They
you,
are really
Commissioner. Is that
noisy
rooster
right
in
now.
your
I think they
kitchen,
know.
or is it eating its dinner or there? That is really pretty cool for us. Anoka used to be a kind of a semi-rural place, and it's just gotten subsumed by the metro. Anyway, I appreciate your comments, and I appreciate you getting together as quickly as you did to sort out the list. And I think, knowing how things go sometimes, that you got a pretty high percentage of the things that you were hoping to get done. So that's really very good. So I commend you for that. And I just want to offer my encouragement to you as the chair of your group. That's such an important one. Is that we're going to have to look at everything a little differently. The depth of the depth that's going to be profound. And people think we have all the money here, and I know that we have challenges that are amazing. And so some of the concerns I expressed about the foster, issues, the child protection issues with direct supervision or phone calls, those are going to be some of the easy questions that we have to come up with. I think, how are we going to help people just get some of what we consider essentials, services and otherwise is going to really be on us. So at least it's a good start for now. Any questions for the commissioner? Senator Bingham.
Thank you, Commissioner Morris. So good to see you. It's been a while, but Mr. Chair, I think One of the profound things that she said is that going into next year, making some of these things permanent. Senator Kiffmeyer had a very good bill that we all passed off the floor regarding to streamlining some of the things that counties need to do to be more efficient. And this is the same. It's going to be a rough budget year next year, and giving them the flexibility and just that allowing them to do things in an effective, efficient manner that they know how they can do instead of us telling them how to do it, I think is going to be an important thing going forward. So I appreciate Commissioner Morris being here today and saying that, and looking forward to working with her and AMC in the future on how we can make some of these efficiencies permanent, because that's the way we're going to have to go, Mr. Chair.
Yeah, I think, unfortunately, I think both of us are correct. It's going to be, but it's very important. I think this is a good start for that. Any other questions for the commissioner? So I think with that, I'm going to turn the gavel over to Senator Utke with the transition from roosters to Blue Earth. I think it's just natural, and I think Senator Utke knows something about roosters as well. So my final thoughts on this. We are going to be working to put together, there's already a draft floating around, but to combine the 60 days with the final list of what this is. If members have concerns about any of these, I would invite you to get a hold of me directly, and members of the listening public, which have got to be in the tens of thousands of watching this important meeting, get a hold of me because we're going to decide pretty soon, and the special session is going to move along. It's my expectation that Friday we're taking up the residue of 3322 and suspending the rules, etc. Sans Article 9, just to make it the latecomers know. There's no Article 9 in the bill on Friday. And then we'll come back, I suppose, Monday with a worked out list of what's going to be extended, hopefully just as strongly consensus as that. So anyway, with that, I'm going to hand the count over to Senator Utke, and I'll see you in special session. Thank you very much.
Thank you, Chair Abler. And members, we will move on to our next testifier, Ms. Youngerberg from Blue Earth County. If you would please just identify yourself and go ahead with your testimony.
Good afternoon, members of the committee. Thank you for having me today. My name is Angela Youngerberg. I am the Human Services Director of Business Operations for Blue Earth County, and I'm also an executive committee member for MACSA, so the Minnesota Association of County Social Service Administrators. And we worked very closely with AMC on this effort to go through all of the list of waivers and modifications and work collaboratively with AMC to put forth a list that we feel really best meets the needs. I was asked this morning from a coworker why I wanted to testify today. And I said, well, first, it's an opportunity that I can't pass up as a public servant. And I would be able to now say that I participated in a Senate committee hearing by Zoom, which, not everyone has that opportunity. But most importantly, and secondly, is that this is different. This is really different than many of the other times that I've been in front of this committee. I've often come before you to do things such as requesting funding, telling you about an innovation, defending an idea or policy. But most importantly, I felt it's been my job to paint a picture as to how the work that we do in the community matters to the people that live in Minnesota. And that holds true today. However, today I'm really coming in front of you asking for tools, and they're tools that we've already heard many comments on, but short-term tools. As county human service agencies, we need some additional tools in our tool belt because I'm certain that the most uncertain times are yet ahead of us in regard to the recovery phase and delivering services efficiently in the community. It's unlike how we've ever delivered services in the past. We're having to think very creatively and very differently. Counties have greatly appreciated all of the waivers and flexibilities and the work on the part of the department to get this information out to us and collaborate so that we can meet the needs of the people that we serve. At the forefront of our minds are always Minnesota's most vulnerable populations, and these are the populations that we serve every day. So today I'm also representing the vulnerability of our workforce. Our workforce is quite vulnerable in this, and most of the time we're in the position where we're delivering services. Well, we have, members of our workforce collectively across the state that undoubtedly are impacted by the pandemic. And so we're balancing the impacts personally and also still trying to deliver services to those that live in our communities. So today, on behalf of the population that we serve and the workforce that serves them, we're asking for the ramp down period and to extend only a few of the waivers that have been granted during the peacetime emergency. So the ramp down period, we're really hoping, and sounds promising based on the conversation already, of at least 60 days to ensure that we're transitioning our practices in a very responsible way. We're not able to just flip the light switch. That was easier to do on the front end than the back end. It's very difficult when we look at recovery. Counties are also asking for an extension of a limited number of the essential waivers and modifications, so that we're talking about client safety, access to services after the peacetime emergency ends. And so we know that things are not going to just snap back to how they were pre-COVID-19, and we're adjusting to a new normal, whatever that may be. So staff are working from home in many respects. There are changes in how we're interacting with those who receive services, new safety considerations, challenges in accessing services, new models of service delivery. All of those things are things that we are working through on a daily basis. In the packet today, you'll find that AMC's Blue Ribbon Commission and MACSA collectively prioritize the waivers and modifications. And if I've counted right, because there's been so many adjustments and changes over time, that I think we're asking for 14 out of 60, more than 60 at this point. And we put them into categories. And through that categorization, we were really looking at values about health and safety and equity and access and efficiency and efficacy and modernization, and all of those really important philosophies. And so the three categories that we lumped them into are using technology to support essential practices, and that includes all of the telemedicine, allowing phone video use for case management, waiver services, and others. The tele-everything, I believe, is how it was referenced before. And we're getting very good at that. That is becoming very accepted and very sought after by the people that we serve. The second category is maintaining access to housing and economic support. So that is the ability to support or to have housing support for clients moved to non-licensed settings during a quarantine situation that was talked about earlier. And then the third area is about systemic savings and efficiencies. And in this, the 90-day supply of prescription maintenance medications is one example. And also suspending some of the application requirements for economic assistance programs would also be in this category, as well as the flexibilities that have been offered regarding the county cost share about the direct care and treatment facilities. And when there's struggles of having someone discharged from a facility due to a COVID-related situation, that cost burden that comes on the county, that waiver was greatly appreciated. And we're hoping for that one into the future. Obviously, as 60 days is great, but much longer time is needed. We had 4 areas in which 5 areas in which we differed from the list that DHS shared with you earlier today or earlier in this hearing. One was about economic assistance. 2 are related to child protection and foster care, and 2 are related to the certification of mental health centers and licensing of substance use disorder licensing. And there are various reasons in which there was not agreement on these. The economic assistance one specifically was about application requirements, and we're not looking for the entire thing to be extended, just some very narrow provisions within that modification that would really help with access to individuals, and really aligns with all of the other programs that we manage. And the last one that I just wanted to draw, well, in addition to that, to return to doing some of those economic assistance duties in a face-to-face manner would take a great amount of PPE and resources, of which are obviously in high demand these days and difficult to come by. I just want to share with you that just in, this is an example just from Hennepin County alone, in order for those application requirements to kind of, the light gets switched back on those, staff will need 1,400 pieces of PPE, and residents will need 17,900 PPE over a 6-month time period just to conduct the face-to-face and obtain the signatures. And so there's a balancing act that we'd like to look at with that one specifically, about using some of the electronic signature means and other options while yet maintaining the integrity of programs. So I just want to thank you again for all of your time and attention and work and understanding about what this recovery effort looks like from a human services programmatic standpoint. And I thank you for allowing me to offer some testimony to you today, and I would stand for questions.
Thank you. And members, anybody have any questions for our testifier? Oh, Senator Kiffmeyer.
Thank you, Mr. Chairman. I heard briefly the subject of digital signature. We did the bill, as Senator Bingham mentioned, that did deal with doing digital signatures for several county practices. Are you speaking of something different or speaking in favor of continuing them? I couldn't quite gather from your comments.
Sure. I am speaking specifically about the MFIT program and some of the requirements that would go back in place regarding the MFIT program, the requirement of the face-to-face interaction and the actual signature that needs to be obtained. We would not be asking for a verbal signature, which is what the modification allows for right now. But much like the other programs that we administer, we are able through Apply MN to obtain a digital signature or electronic signature for other programs. So it would be simply using the same type of technology to apply to this specific program.
So, Mr. Chairman?
Senator Kiffmeyer.
Yeah, so what hinders you from doing that? Is this a federal limitation, or is this a state enabling that is needed?
Ms. Youngerberg.
My understanding is that it is a state policy that is limiting this at this time.
So, Mr. Chairman,
Yes,
I would like you, Ms. Youngerberg, to take a look with the current law in place on digital signature and see if there is language that you could come up with. We've certainly done it in other cases that meet legal requirements, so on and so forth, but you would need to talk to AMC staff in regards to that worked with me, and see if there's some options here that we could do for you. The question is, this is the first time I'm hearing about that, And now here we are 2 days before a special session. I don't know that we can get all the information and agreements we need in this short a time, but I would like you to get more information anyway.
Thank you. Members, anybody else have questions?
Yes, just a quick one,
Senator Bell?
Angela. Thank you, Mr. Chair. Angela, I know we put together a little change in a statute. This was based on Sherburne County's input on this delay of face-to-face. And that was introduced, but was in judiciary. Is this the type of thing that you were looking for? Basically, it extends that 5-day period for the first face-to-face. And is that what you're recommending by the extending certain timelines?
Ms. Youngerberg?
Yes, that's absolutely what we're looking for and what we're looking for extending. This was actually a bill that, as you referenced, that you authored earlier this year, Senate File 3664. And that is absolutely what CB 33 would match up with, yes.
Okay. Very good. Thank you, Mr. Chair.
Thank you. Any other questions? Otherwise, we'll move on to the next testifier. And next one up is Mr. Bergeron with Minnesota First Provider Alliance. Welcome to our committee, and please identify yourself and continue with your testimony.
Good afternoon, Mr. Chair and members. My name is Matthew Bergeron, and I'm an attorney with the law firm of Larkin Hoffman. I'm speaking to you today on behalf of the Minnesota First Provider Alliance, a statewide association of over 200 personal care assistant and direct support agencies. First, I would like to thank you all for including the PCA supervision waiver in the amendment you're discussing today. The Provider Alliance worked with DHS for over 2 months to get that waiver in place, and we believe that allowing qualified professionals to supervise PCAs via telephone or video goes a long way towards protecting the health and safety of the seniors and individuals with disabilities who receive PCA services, as well as the dedicated workers providing that care. While we recognize the sensitive nature of background studies, the Provider Alliance strongly urges the committee to consider extending the waivers and modifications of certain background study requirements, including fingerprinting, contained in CB 23. Please let me be clear. The Provider Alliance absolutely supports these vital screenings under normal circumstances and looks forward to being able to return to conducting these studies as they have previously. I do appreciate Senator's comments earlier that these waivers may be extended 60 days beyond the peacetime emergency. That is absolutely vital. If the peacetime emergency were to end without some legislative action creating a grace period for providers, any new employee hired during the peacetime emergency, including those who changed employers as a result of an agency closure during the crisis, would have to immediately stop providing services until such time as a full background study could be completed, and that would be leaving their clients without vital care and support. However, it does remain unknown how many of the fingerprinting facilities have reopened and how far PCAs would have to travel to get their fingerprints taken, and how long it would take for them, the state to process the backlog, as well as any new background study requests that continue to come in. This is why the Provider Alliance has requested that the legislature extend the current waivers in place for 120 days after the commissioner determines a significant or sufficient capabilities exist to process the new and backlogged background study applications. This extended grace period may be essential to avoiding serious and potentially life-threatening service interruptions. Lastly, I would note that the PCA or the Provider Alliance has long supported increasing the monthly hours cap for individual PCAs from 275 hours to 310 hours, and we'd like to see that extended as well. However, we recognize that unlike our other priorities, this does have some cost associated with it and may not be possible at the time. Thank you so much for the opportunity to speak with you all today, and I'm more than happy to answer any questions the committee might have.
Thank you for joining us today. Back to members, we have questions for Mr. Bergeron.
Yes, Mr. Chair. Thank you. Has there been any, Mr. Bergeron, or maybe someone from the department, has there been any tracking at this point on whether the increased hours cap has actually led to an increase in cost? I know there was some concern as we were looking at this as to whether that actually was going to result in an increase in the actual cost. outlay. And I'm wondering if anyone has looked into that, because I think these extended hours are important. We have a shortage in the workforce. This is a very good way of at least somewhat plugging that hole. And so I'm wondering if there's anyone can give us any update on the actual costs.
Have anybody on it can jump in and answer that? I don't know. Mr. Bergeron, do you have an idea on that? Or, oh, okay, I see Matt Burdick. Okay, Mr. Greenman.
Mr. Chair, I don't think we have any of that information at this time. We can certainly look into it though and get an answer for you.
Okay, we'd all appreciate that. So you just actually reply back to Chair Abler probably, and then you can share it.
Sure.
That would be helpful.
Okay. Senator Ralph, anything further?
No, thank you, Mr. Chair.
Okay. Anybody else have questions for Mr. Bergeron? Okay, we will move on to our next testifier, and I'm going to apologize right up front because Mr. Sai, and we got to get you off mute.
Hi everyone. My name is Himmat Singh.
Please identify yourself and then continue with your testimony.
Thank you very much. I'm very grateful to the Honorable Committee for this opportunity. My name, like I said before, is Himmat Singh, and I am the CEO of Circle of Life Home Care, Anishinaabe. We operate mostly in northern Minnesota, on and off reservations. So most of our clients are Native Americans, but we welcome everybody. Our values are certainly universal. Like everybody is probably aware, our population, Native Americans, are among the most vulnerable when it comes to underlying health conditions in terms of diabetes and chronic liver disease. I know it was mentioned earlier in the call about the once in a century pandemic, but perhaps it's, given the legacy and history with Native Americans, they've suffered a lot in terms of disease, which goes back hundreds of years. So this has certainly impacted us more than, and it's extremely tough environment to run a business and operate a business. And, I personally experienced 9/11 when I lived in New York, and the great, financial crisis when I had to do a turnaround on a chemicals company. But this has been, in many ways a lot worse. And we're very grateful to the state for all the support we get. But the waivers in particular that I wanted to, testify and provide, my testimony and ask for an extension for would be CV15, continuing to allow for face-to-face visits virtually and allowing phone or video visits for waiver programs. CV43, which is expanding remote home and community-based services, waiver services, and also CV53, which is just mentioned, which is to be able to allow the hours to increase from, to 310 from 275. And I would say the same thing that the gentleman before me, Mr. Bergeron, mentioned about the background study as well. That's a unique problem for us as well, particularly in northern Minnesota, but also even in Minneapolis. There's a couple of establishments that got burnt down in the riots, and so it's having that 120 days in terms of extension and being able to process that would be really quite necessary the way we look at it. And finally, I know this is not the committee. This is not something on the agenda, but as an industry, what we do is really keeping people safe at home and keeping families together. It really is a win-win for all the stakeholders in trying to keep the costs down for the state and at the federal level too. So do, the rate increase, given the just the headwinds that we have in the industry, the low margin pressures that, as we have as operators, is, even the 15% rate increase is something that I would, sort of really humbly ask you to consider that, especially particularly with also the minimum wages, which are going to be kicking in the next couple of weeks. So that's all I had to share, but, thank you very much for the opportunity, and I can take questions right now.
Thank you, Mr. Singh. Members, questions for our testifier? I don't see any hands up or anybody waving, so thank you very much, and thank you for joining us. And we'll go on to, I list our last testifier. Is it Ms. Tripp? Do we have anybody on? I didn't see anybody on the screen.
Mr. Chair, I saw Ms. Tripp join at the beginning of the meeting, but it looks like she's no longer on.
Okay, thank you, Brittany. Then members, if anybody have any other questions or comments on anything we've covered today that you want to bring up? Otherwise, we've reached the end of our list, and we would wrap it up for the day. So if anybody waves quick. If not, thank you all for joining us, and we will see the members here on Friday at our special session. And for the testifiers, thank you for joining us today, and we will stand adjourned. Thank you.